and Thailand have been very efficient controlling the spread of this H5N1 virus, while those other countries were very corrupt with very little vet facilities and human resources is not controlling the disease at all. So yes, there's been a small number of human cases that has killed a very few number of people, but I remember that all the experts were saying we're not sure that the H5N1 has the potential to become the real pandemic virus. It may come from another source. So again, it's the responsibility of our governments to prepare. I don't know if the scare was such. For instance, in Mexico right now, the people are not very scared. They're responsible and they're abiding by what their government is saying, but they're not scared.
Well, Jean-Michel, what about the accusation that newspapers bear a certain amount of responsibility for scary? People love scary stories, don't they? And scary stories make good headlines.
I don't
Newspapers
know.
use them.
I went, for instance, in Turkey. At the border with at the Mount Arara, when there were 3 deaths in children in a family that had, and we decided to go there, and we were not alone. The BBC was there, and Le Monde was there. There was a number of journalists that were covering the issue, and it was a different story than, for instance, on that lake in China where thousands of birds were dying because suddenly it was closing up to Europe, and it was human, and it was a decision that Le Figaro took to go there and see by itself what the situation was, and I think it was right to do it. And you cannot ask the journalists not to cover the news when it's coming.
Let's leave that issue for the moment. Mark, you clearly think that money could be better spent in other ways.
I think that mutation which increase the risk of contamination or even of pandemia have been a regular occurrence in the history of flu. And until recently, such occurrence of a new virus did not trigger a media alarm. So what has changed? I think that the main change is that we have now available vaccine and antiviral products with a huge potential of financial return. The problem is that there is no serious evidence of efficacy or even safety for these products. For example, in Japan, that is less than 2% of world's population, the reported number of deaths potentially related to Tamiflu has been 80.
I agree that in the past, for instance, there has been false alarms. For instance, in 1976 in Fort Dix, it was an army base in New Jersey, a private soldier died from what was swine flu. And the Ford government at that time decided to hastily put together a new vaccine that was not controlled as well as it should have been, and 24% of the American population was vaccinated, and there was 500 cases of Guillain-Barré syndrome, which is a paralysis of the motor neurons, and 25 deaths because of the immunological response to that vaccine that was not properly controlled. So yes, it has happened in the past, and it may happen also in the future. But we still.
Jean-Michel, if Mark is right, and a lot of these antiviral drugs are ineffective and become quickly outdated, then surely the chief beneficiaries of these developments are simply the pharmaceutical agent.
Sure, but the pharmaceutical industry and the manufacturers of vaccines, they don't have a responsibility politically, and they're just they're just actors of the system. And when we speak with them today, they say, look, we're abiding, but what the governments will tell us to do. Yes, the antivirals may become ineffective. There is an H1N1 human strain of the seasonal flu that has become 100% resistant to Tamiflu, for instance, and it's getting over the world. So but it was the case too with bacteria and antibiotics. It's also because we have to make a reasonable and responsible use of those drugs, which perhaps is not exactly the case. For instance, you have people who travel and they want to have the Tamiflu, and they're able to take one box of Tamiflu in one day.
We're beginning to run out of time. Mark, do you think that the World Health Organization, the WHO, has to reassess its priorities?
I think that the World Health Organization is regularly challenged about the competence and the conflict of interest of its experts.
Simple.
May I remind that as early as in 2005, I published in the US open letter to the director of the World Health Organization to challenge his vision of avian flu.
Yes,
and to say that was a false alarm.
It's true that WHO has a political mandate and has to abide by all the members of states. And for instance, yesterday we were very surprised that we were not yet in phase 4 of the pre-pandemic alert. And it came late yesterday. Yeah. So there is a delay in the decision with WHO. I agree with that, because of political encumbrances.
So do you think there needs to be reform of the WHO?
It can't be reformed. I'm sorry to say that. It can't, because it has, as I said, all the decisions are made for and with the appeal of all the member states of
WHO, in other words, is a prisoner of the states above it.
Well, yes and no, because, for instance, Mrs. Grodland, when she was Director General, she was very active trying to stop tobacco use, and she did that against WHO.
I'm going to have to stop you there. We've run completely out of time. Do join us again tomorrow for another edition of Face Off here on France 24. Goodbye.